Have you ever really thought about that small organ tucked away under your liver? Probably not. But in this explainer, we're diving deep into the gallbladder. It's a tiny powerhouse that, when things go wrong, can cause some big-time problems. We're going to cover everything from what it's supposed to do to the major red flags you need to know about. So let's get right into it. Here's our game plan. First up, we're going to meet your gallbladder, what it is, and what its day job is. Then we'll get into the most common troublemaker, gallstones. From there, we'll see what happens when things get really inflamed, touch on a few rare and unusual cases, and then wrap things up by looking at polyps and other serious warning signs. All right, let's start with the basics. Before we jump into all the ways it can cause trouble, we've got to understand what the gallbladder is supposed to be doing. What's its whole purpose in our digestive system? So think of your gallbladder as this little storage pouch. Your liver, it's this amazing factory that's constantly making bile to help you digest fats. But instead of just letting it drip out all the time, the gallbladder collects it. And here's the key part. It concentrates it, making it super potent. Then it holds onto it until the perfect moment. It's a really smart little system. And you can see its daily rhythm right here. When you're fasting, say between meals or overnight, your gallbladder's just hanging out all full and plump with that concentrated bile. But the moment you eat a meal, especially a fatty one, bam! It gets the signal and it squeezes all that good stuff out into your intestines to get to work. It's this constant cycle of filling up and emptying out. So, when doctors think something might be wrong, they'll do an ultrasound, and they're basically looking for two magic numbers. A normal gallbladder should be less than 4 centimeters wide, with a wall that's less than 3 millimeters thick. If either of those numbers is bigger, that's a huge clue that there might be a blockage or some serious inflammation going on. Which brings us perfectly to the #1 villain in almost every gallbladder story, gallstones. Okay, get ready for this, because this is a wild stat. About 10%, 1 in 10 people, are walking around with gallstones right this second and have absolutely no idea. For most folks, these stones are totally silent, which means they just sit there and don't cause a single problem. So what are these little things even made of? Well, as you can see, the overwhelming majority, a full 75%, are made of cholesterol. It's pretty simple, really. If your bile has too much cholesterol in it, it can start to crystallize and, over time, form these little, or sometimes big, stones. So you have these silent stones. What happens when one of them decides to stop being so silent? Well, that's when things get bad. It leads to a condition called acute cholecystitis, which is basically a super painful, inflamed gallbladder. And it's the #1 reason people need to have their gallbladder taken out in an emergency. Now, to really get what's happening, our source gives us a perfect, if kind of gross, analogy. The best way to think about this is to imagine a giant internal pimple. Seriously, it all boils down to one simple problem: a clog. And if we stick with that pimple analogy, it happens in 4 predictable steps. First, the clog. A gallstone gets lodged in the little tube leading out of the gallbladder. Second, things start to back up and the gallbladder swells or dilates, which is what causes all that pain. Third, the trapped bile starts to irritate the gallbladder wall, making it inflamed and thick. And finally, if it goes on long enough, bacteria can get in there and cause a really dangerous infection. So back on that ultrasound, a doctor's looking for this classic combo of 4 signs to nail the diagnosis. 1, is there pain when they press right over the gallbladder? 2, can they actually see the stones? Happens in about 95% of cases. And 3 and 4, are those magic numbers back? A gallbladder wider than 4 centimeters and a wall thicker than 3 millimeters. You put all 4 together and you've got your answer. Okay, we've talked a lot about stones. But believe it or not, sometimes the gallbladder can get inflamed for other reasons. So let's dive into a few of the stranger things that can go wrong. So let's ask the question, is it possible to get that same horrible pimple-like inflammation without any stone causing a clog? It sounds weird, but the answer is a definite yes. This is a really serious condition called acalculous cholecystitis. Acalculous literally just means without stones. And you typically see this in patients who are already critically ill, folks in the ICU after a major surgery or a big trauma. Their body is under so much stress that blood flow to the gallbladder can just plummet, and the organ gets inflamed all by itself. No clog needed. And then you have these two, and they are a mouthful: adenomyomatosis and cholesterolosis. They're both benign, totally harmless conditions that just involve weird changes to the gallbladder wall. And you know what? Telling them apart is mostly just an academic exercise for radiologists. Clinically, for the patient, it doesn't really make a difference. All right, for our final section, we're going to look at growths that can top up inside the gallbladder. We'll start with something super common and usually harmless, and then we'll finish with a much more serious red flag. When it comes to gallbladder polyps, it really all comes down to one simple thing. Size matters a lot. If a polyp is tiny, we're talking less than 5 millimeters, it's almost always a harmless little cholesterol deposit, nothing to worry about. If it's in that middle range, up to 1 centimeter, a doctor will probably just want to keep an eye on it. But once it gets bigger than a centimeter, that's when it becomes worrisome, and removal might be the safest option. And that brings us to our final and most serious condition. It's rare, but it's called a porcelain gallbladder, and it's pretty much exactly what it sounds like. The wall of the gallbladder becomes calcified, turning it hard and brittle, just like a piece of porcelain. Now, here's the most important thing you need to know about this. Finding a porcelain gallbladder is a major, major red flag, and that's because there's a very strong link between this condition and gallbladder cancer. Because that risk is so high, the standard recommendation is to remove the gallbladder. No questions asked. So, what's the big takeaway from all this? I think it's just amazing how this small, easily ignored organ can go from a quiet little helper in digestion to the source of a life-threatening problem. It's a powerful reminder of just how complex and interconnected our bodies are, and how a seemingly simple issue like a tiny blockage can set off a huge chain reaction. Thanks for joining me.